Hello viewers, my name is Dr. Rajiv. Welcome to my education channel, YouTube Surgery and Orthopedic Education. We shall today discuss metabolic response that takes place after trauma and surgery. At the end, please subscribe to our channel and give us a like if you find the lesson useful. So let us not waste time anymore and get set go. Response to trauma and critical illness includes various neuroendocrine, metabolic and immunological changes. The magnitude of these changes corresponds to the amount of exposed stress, that is injury or insult. The direct effect of mediators like TNF-alpha and interleukin-1 and 6 on the hypothalamus is well known. These are released from traumatic and involved tissues. However, many new studies have stressed on the nuclear factor kappa-B or NF-kappa-B in this regard. These changes and effects function to restore homeostasis after any injury, including surgery and critical illness. Many complex interactions involving the neuroendocrine, cytokine, and metabolic pathways drive the post-traumatic tissue response. For example, cortisol acts synergistically with interleukin-6 to promote the synthesis of hepatic acute phase proteins like C-reactive protein and ceruloplasmin. ACTH release by the pituitary is enhanced by pro-inflammatory cytokines, resulting in rise of cortisol levels in an effort to limit the pro-inflammatory stress response. Hyperglycemia aggravates the inflammatory response via substrate overflow into the mitochondria, leading to the formation of excess free oxygen radicals and altering the gene expression to enhance cytokine production. At the molecular level, there are changes in messenger RNA expression in leukocytes following the exposure to bacterial endotoxin. An important player in this scenario is a transcription factor called nuclear factor kappa-B. It is held in the cytoplasm in an inactive state by specific inhibitors. The activation of the nuclear factor kappa-B is primarily initiated by bacterial endotoxins such as lipopolysaccharide and pro-inflammatory cytokines such as tumor necrosis factor and interleukin-1. The nuclear factor kappa-B moves into the nucleus and activates the transcription of a specific genes. The nuclear factor kappa-B plays a central role in inflammation, a stress response, cell differentiation, and apoptotic cell death. The metabolic response to trauma in humans has been categorized into three phases: the Ebb phase of decreased metabolic rate or early shock phase, the flow phase of hypermetabolic state, and the recovery or anabolic or adaptive phase. The natural response to moderate injury is designed to ensuring survival in the absence of medical aid. There are three main responses: immobility, anorexia, and catabolism. Sir David Cuthbertson described the ebb and flow model of post-traumatic metabolic alterations 93 years ago in 1930. He postulated that the characteristic response that consumes protein and fat and preserves body fluid and electrolytes occurs primarily during the early phase or Ebb phase, and a hypermetabolic flow phase follows the Ebb phase. The early Ebb phase of low energy expenditure is replaced by a high expenditure phase or flow phase several days after injury. These two phases combine to produce the first inflammatory response to injury, known as SIRS, that is systemic inflammatory response syndrome or the acute phase reaction. The initial Ebb phase develops approximately 12 hours after trauma or surgical stress and lasts for 24 to 48 hours. It may be ameliorated by resuscitation but not completely abolished. The Ebb phase is marked by hypovolemia, hypothermia, decreased basal metabolic rate, reduced cardiac output, and lactic acidosis. The main hormones modulating the Ebb phase are catecholamines, cortisol and aldosterone due to the activation of renin-angiotensin system or RAS. The magnitude of this neuroendocrine response depends on the severity of the injury. In this phase, decreased oxygen consumption and reduced temperature lower the body's total energy needs and divert energy towards adaptive immune responses or CARS or compensatory anti-inflammatory response syndrome. The main purpose of the Ebb phase is to conserve both the circulating blood volume and the energy stores for recovery and repair. In the timeline, the low energy Ebb phase evolves into a high energy flow phase. The flow phase is marked by an increase in baseline energy expenditure that can progress to a chronic hypermetabolism. In this phase, there is mobilization of body energy stores for recovery and subsequent repair and replacement of lost or damaged tissue. One of the primary mechanisms underlying this hypermetabolism is the activation of toll-like receptors on innate immune cells like leukocytes by antigens from contaminating microorganisms such as endotoxins. Activated leukocytes produce pro-inflammatory cytokines that mobilize amino acids in the muscles and peripheral fat to the liver to make acute phase proteins such as C-reactive protein instead of regular proteins such as albumin and transferrin. The flow phase is characterized by tissue edema due to vasodilatation and increased capillary leakage, increased basal metabolic rate or hypermetabolism, increased cardiac output, raised body temperature, leukocytosis, increased oxygen consumption, and increased gluconeogenesis. The flow phase has been subdivided into an initial catabolic phase, lasting approximately 3 to 10 days, followed by an anabolic phase which may last for weeks if the insult is extensive and prolonged following a serious injury. If the primary injury or illness is severe and prolonged, the helper T cells induce counter-regulatory or adaptive responses known as compensatory anti-inflammatory response syndrome or CARS, leading to repair and recovery which may continue for weeks.